My name's Eleanor. I'm Engagement Manager for Digital Care Hub. Just kind of before we start and begin with our speakers, I just wanted to say that this webinar is now being recorded and will be available on our YouTube afterwards. And to say that attendees are on mute and you can't be seen. So if you have any questions, please use the Q&A function. We will be monitoring that, and that is where we'll be able to ask the speakers questions, intermittent phases and at the end. And so there'll be plenty of time for all of that. So don't worry. So do pop them in there if you need to. And as we said, the recording will be available with the presentation afterwards. So just to go over the agenda, as I've just said, introductions from myself. And just when you get the chance, if you could put in the chat your role, that would be fantastic and help us kind of have a look at who our audience is today. Then we'll be joined by Carolina, the Chief Executive of the Care Workers Charity. And then we're going to hear from two key frontline social care workers themselves about how they've used tech in their organisations. Then we'll be moving on to Dan, who is a trustee for Natural Breaks and also works at Digital Care Hub, to talk about his experience with care workers and the social care with regards to tech. And then there'll be a chance for moderated Q&A at the end as well, as there may be some time throughout. But do keep your questions popping through on the Q&A function. Then we will close. If we wrap up a bit early for whatever reason, then I'm sure everyone would appreciate a few minutes back. So that will be the case if so. But yeah, for now, we will begin. Oh, just quickly, I'll have an overview of Digital Care Hub in case you're not aware of us. So we are run by care providers for care providers. So we're funded by the Department of Health and Social Care. And we reach a huge wide audience of social care workers through kind of all our different resources. Do look at our website and you'll find out our free training and kind of support that we offer with regards to data and cybersecurity. Right, Carolina, over to you.
Thank you. Good morning, everybody, and thank you so much for joining us. So I'm CEO of the Care Workers Charity, and we are a charity for people working in care at the front line. We support care workers in 3 different ways. One is through financial crisis grants, whether it's a broken washing machine, a car needs an MOT, or there is sickness absence only covered by SSP. Care workers can apply for financial support to us with that. Then we provide mental health support where care workers can apply for counselling, online counselling that they can choose when they attend that. It's self-referral, and we've had great feedback on that, especially at the time when NHS mental health services are not really available to many people. And lastly, but in a way most importantly, it's our advocacy and campaigning work around care workers as skilled professionals, around more funding to the sector, and around recognition of the contributions of social care and care workers. Since last year, we've been running an advisory group of care workers and care worker champions group, of which Amanda, Jane, and Destiny are members of, and that's a project funded by the RAIN Foundation, and it enables us give care workers opportunities to have their voices heard, to share their experiences, and to be involved in conversations about policy, funding, and everything else that's important in social care. Earlier this year, we published a guidance on co-production with care workers, and that's really important to us, that any care provider and any stakeholder in the sector listens to care workers in any big or small decision that they make, and that definitely includes tech in services. You know, I'm not necessarily talking about have care workers involved from the moment you are choosing from 20 services, because that might be difficult to manage logistically. But having a survey asking care workers what would they need, what would help, or also having a conversation once you've narrowed it down to your 3 finalists for possible, say, software provider. Have a care worker or 2 there on your panel, on your interviewing panel. Have care workers actually test the software and make sure that the people who'll be using it the most are happy with it. So that all really goes back to the relationship of care work and technology. We strongly believe that technology shouldn't be here to replace care workers, because care workers are irreplaceable. because care work is all about relationships, and no tech can replace relationships, empathy, and care. But what we believe care technology can support with is taking away some of those very mundane admin tasks that the care workers have, supporting neurodiverse care workers in their work. So, for example, people with dyslexia, with note taking, etc. And just making sure that time is freed up for care workers to spend more time with people they support in more meaningful way and build those meaningful relationships over time, rather than having to worry about all the compliance and note taking and other things that we have in the sector that we have to do, but I would say don't necessarily help with those relationships and quality of care in some ways, but they have to be done. We have found that some stakeholders in the sector understand that it is important that care workers are involved in discussions, that it is important that technologies are not thought of and sold as replacing care workers. But we also have seen examples of some of the tech providers selling it as a replacement, and some care providers seeking it as a replacement. And I think it is really important to stress that from a point of view of quality of care and relationships, it's probably not a very good approach to take. In terms of where we think the technology is going to go in adult social care, I think we have such great potential in terms of being able to talk during visits, during interactions, and having notes recorded as we go, rather than having to write them up and take up time afterwards. I think there is so much potential in terms of data analysis, data comparison, because we collect vast quantities of data in social care. There are so many different monitoring systems. There are so many different things that we record and check. So we may have to make better use of that data. It can't just sit there as something has been recorded. It's like, this has been recorded. Let's compare it to a similar thing or the same thing that was recorded last week. Can we see any patterns? Can we take any actions from that to improve quality of care, to reduce potential risk of falls, to improve somebody's sleep, etc., etc. So I think there's definitely massive potential in terms of data analysis, data interpretation, and then actions to be taken from that. And I think what's not often spoken about is entertainment, and it's bespoke to the individual entertainment. You know, I've spoken to care workers who use image generative AI to create pictures of what people find interesting or they are close to, or creating different activities that can help them get closer to a person. There are also great tools to actually do a quick search on something that maybe a care worker didn't live through because they're not the same age as the person they are supporting, and a good way of finding information. We about how technology, AI is used in social care. That's why we've been involved with the Oxford University and statement of expectations on the responsible use of AI and guidance from the care workers' point of view on that, just to make sure that there are lines that are not being crossed, especially in the terms of use of personal data of people who are supported, but also personal data of care workers, that Gen AI isn't being used just to cut and paste from one care plan to another or fill them with information that's not necessarily relevant to that individual, but that any technology and AI is actually used to improve lives, improve quality of care. And what we also have to remember is that it should be used to not only support people who draw on care, but definitely also to support people who work in care. And that comes into places like rota management, creating support plans for people that actually work in care, because they may have different needs, like I say, around neurodiversity, around childcare, around long-term health conditions. And technology should be able to help us and is able to help us with that. But yes, just reminder to people that it can't be just about people who draw on care. The workforce needs the same level of support, because we can't really expect care workers to deliver great quality of care without being supported and treated with respect and with recognition of their human rights and their needs, and that they have lives outside of work at the same time. So yeah, just to finish up, because I'm really mostly interested in listening to Amanda Jane and Destiny, because I can go on, but I'm not the one anymore working at the front line, is that we need to listen to care workers. Any tech, AI change in your services should be driven by conversations with people who deliver care. And it should include care workers as well. We need to be looking after care workers the same way we do people that care workers support. And we always hear if anybody has any questions. Today there'll be a Q&A later on that Olivia will be very happy to answer any questions. We have an info email on our website, and Olivia will put it in the chat as well if you want to get in touch with us. And we are definitely planning on doing a lot more work in terms of tech, AI, and anything else digital, the future of social care, and how that needs to work for care workers and how that needs to work with care workers, rather than being a replacement for them, which isn't really possible in our opinion. So thank you.
Brilliant. Thank you, Caroline. It was really good to get your perspective on things and the journey that it's going to go on. Right, it would be great to hear from now Destiny and Amanda Jane. We've just got a few questions that we kind of chatted about. I guess, what tech have you worked with before? You need to unmute.
Hello, can you hear me now?
Yeah.
Yeah, I've worked with the EMR system where we use for medication administration system to give medication to patients. Also use the Atlas in other care rooms where we also use that for. Can you hear me?
We can. You broke up a little bit at the beginning. I think it was the EMR system, but I didn't get the second one.
Yeah, we've used the EMR system. I've also used the Atlas still on medication administration system, and we've also used the care assist, where we use that to record in terms of the care plan and the daily notes. I've also used the like the pod system, where it's like an iPad placed on the wall, where we use that to record the resident daily note also. So we've all used that, but sometimes the problem that we encounter is that the training is not adequate. Because I could remember when the EMR system was introduced to where I work, the units where I work, a group of about 2 trainers, they came around to deliver the training, and the night staff wasn't really put into consideration because it's not fair on them. After you've done a night shift and they've arranged training for 11, 12 o'clock, and how are you going to stay back to do that? And some of them are not in the training. So they didn't really put into consideration for them to be included in the training. And after they delivered the training, about 3 hours training, and they didn't come back again to include the night staff. So they really struggled. And that's a massive problem, because there's a lot of tasks that needed to be done. They have to rely on us, and we are not expert in it. So that's a challenge.
So you felt like the training for all the systems you've done, or just one in particular?
I think the main thing is the care assist, there wasn't any training on that. So we learn from each other, like, you know what I mean? Like, you should try that, like common stuff. But it was just the EMR system that we got 2 trainers that came around to deliver the training, but the night staff wasn't really included, and everybody wasn't included. It was just one-off training, and that wasn't inadequate. So yeah.
Yeah, sounds a bit there's a bit disparity between the levels of training that you receive for the different systems, if any at all. Okay, brilliant. Thank you. We'll come back to you. Amanda Jane, what sort of tech have you worked with before? You still with us?
Hello, everybody. So my experience was with the Nourish system. Can you hear me okay? Yeah.
Yes, we can. Yes, thank you.
Unlike Destiny, I was one of the champions of the system. So I was put on a lot of programs and then sent into service to train other colleagues. But like he says, a lot of the night staff do miss out. That is one thing. I think the night staff actually miss out on lots and lots of different training as well that they're not put on, which can be quite problematic if things happen. But with the Nourish system, we had lots of interactions. We was one of the pilot systems in Nottinghamshire as well, so that was nice. And it was really good that it meant that you uploading things throughout the day instead of just writing your handwritten notes at the end of the day, which you can't always remember what's going on. You can put your fluids in, it'll give you running totals, or it'll put you through your outputs for catheters or over your toilets or bowel movements. Again, you've got your medication, so if you've got time-specific medication, you can see what times it is. Things are popping up on there. You can pop photos on. You can pull reports so that then when the social services come for their reviews or anything, you can say, right, this gentleman's been eating this, or you've got the must things on there with the weighing them. I find it quite useful and very for your ABCs and things. You can pull them up so you can see all your interactions. If you've got family visits, you can say, oh, what did they do last week? And then somebody who's not been there all week can sit with a handset and say, oh, right, so such and such supported them last week. These are the photos of the day or whatever, and then you can share them. Again, they're ideal to do your support plans. Obviously, we walk around with the handheld devices, like Destiny says, we can touch the walls with them as well to do the night checks. And then you can also do a lot more with the laptop or a computer system that you can pop on to update your support plans. You can run a report for if you've got a hospital admission. And as well, you can add new people in, take them out, keep them up to date with COVID, or I think, well, for our company, the Nourish system really works well, and it does everything.
And why did you find it worked well for your company? Was it better training, or did you then, if you were appointed as an advocate, then did you feel that you then trained on your colleagues? Like, did it work better like that?
Yes, I think that so they had a bit of e-learning, and then people could come to you as a person to ask for extra advice. And still going now, you're always saying to people, use a plus sign. So you can build a timeline for somebody and say basics on there, your food, your water, your cleaning, your thing. But then you can add all your different interactions in. And so you can add as many as you can to get it more of it, so that what I always tell colleagues is, if you do it as a diary of somebody's day, if anybody was to come, CQC or anybody, social services, family, if they say, what did they do on that day? You've not put no entries. If it's not on there, it hasn't happened.
Yeah.
So it's in your interest to keep putting, even that you can put a mood swing and just say such and such is sat giggling to themselves, or just had a really nice interaction with a member of staff sat looking at a book or something. And or you could say that the times that they're going to bed. So if you've got somebody with learning disabilities or behaviours, you can say that, oh, they've taken themselves to bed, and then how long was it? So then you put the interaction, going to bed, getting back up, so you can see those time gaps and see where they work, and you can pull them up, and the managers can see for a day. Whereas like if you just got fill it out with handwriting at the end of the day, you can't remember everything.
Yeah, and you can't see it, can you, clearly?
You
So
can
it
take
sounds
your
like
transcript with you, and even if you've got somebody who's on a hospital visit or in hospital, you take the Nourish with you throughout the day,
so they've got
or
the
on holiday.
Yeah. So it sounds like your care home was quite supportive of rolling it out with you and your colleagues, and they
Yes.
understand the benefit of the staff training around that. Okay, that's really good. Brilliant, thank you. So I guess Destiny, back to you. So how did you feel when the different tech has come in your care home?
And can you hear me? Hello.
Hi, yeah, we can hear you. Yeah.
Yeah. Though we feel very excited to use the tech, and we feel very good to explore the new technology. But it's just that the practical application of it is just the problem. For instance, like in terms of the recording system, like the bar recording system that we use on the care assist, you discover that sometimes because it's not very effective, the senior managers, they have to introduce the paper system, that's the paper version of it, where the care staff, have to record it on the paper, like a matrix. It's like a spreadsheet where you have to record that daily. And you also go the care assist where you have to record the bar chart. So sometimes the figures doesn't tally. That's the problem, because they discover that staff are really struggling to, like, especially the care staff. Like me as a team leader, we do sometimes work in the office. So, when we remember, like, we do record it, to be fair. But it's just that the care staff, a lot of time, they struggle. And some of them hasn't got access to the EMR system in terms of the login in ID. And because of that, they have to record it on the chart. And sometimes the chart go missing. And for us now to put everything together to make sure that everything is recorded accurately on the EMR, on the care assist, is a problem. Because sometimes when the paramedics come, if there's an emergency, they want to evaluate if a particular patient have opened their bowels for like 3 days or 4 days, what's the bowel protocol? And sometimes we come unstuck here, we struggle because the recording system is not effective. So we're trying to look at the care assist and look at the paper version of it, and putting that together sometimes is not very accurate. So yeah.
I think that sounds to me a bit also around the training again, doesn't it? Really, maybe the awareness of your colleagues that it's about what to use the systems and when for, so they can see the benefit of them, and then they're probably more bought into using them. Okay, brilliant. Thank you, Destiny.
Thank you.
Amanda Jane, what about your thoughts? How did you feel when Nourish was first introduced?
Like I say, I was excited for it, and also with being chosen to be one of the champions to lead it. And I just thought that it would bring so many benefits of everything, because even down to remembering when care plans are up, you've got your reminders in there that you're dinging up.
Yeah.
But no, I think what maybe Destiny needs to do is, like on his UCANs or his reviews, is to state that to other staff or even to his managers that do we need a refresher course? I know with ours, with Nourish, we do constantly do refresher courses, and they're always bringing something else out so that you can, so that everybody knows. And it's about sharing with the team, even making it a team thing so that everybody knows how to work the system. So if you're going to put a new interaction on there and show somebody how to set up the timings and the parameters and everything, and set them all a task up. Can you put this task on? Can you put that task on? To see how they can do it themselves, or what prompting they need. Even down to when you're uploading all your letters, every letter that comes into the service, it's all uploaded on there, or your letters, everything's on there. Again, that could be, again, I know that our CEO, she's mentioned about AI attacks and cyber attacks and things like that. I don't know what security system we've got on ours, but so far we've not been attacked. But again, it could be very detrimental if it was all to be lost and took down.
Yeah, absolutely.
That's the dependence of having it all on paper, not on paper, sorry.
Yeah, on tech, yeah, definitely. That's why you need to make sure you've got your DSPT and your data security protection toolkit, and make sure you've got your cyber security in place. And we've got a question actually, Amanda Jane. for yourself, how did the Nourish Care plans work for you?
They work really good. So we've got ours written as if anybody, anywhere, ours are really written really thoroughly. They are so that anybody could come into service. So if we had a problem with our service and every single care worker was taken out, somebody could read everybody's plan and they'd know which process, which order people put the socks on whether they brush their teeth before they have a shave, everything. So again, it's there to show. And again, we've got access for agencies to log in as well. Also, we have the availability for anybody to get into the system and use it well. And then we've also got a quick type as well, so that it's just a quick plan. So if you have got an agency in for the day, obviously they've not got time to sit there and read through 3-4 gentlemen's care plans all at once, but they've got a brief plan, then they can look at it later on in the day as the day goes through. And then also to each interaction, we've normally got supporting documentation for it. So again, if it's cream, we've got a body map and things. So
brilliant. Thank you, Amanda Jane. That's really useful. Hopefully that answered your question, Dee. I just wanted to kind of go over back to Destiny. What lessons did you feel that you've learned from the different technology?
I feel that one is just the training is not adequate, and also two, the outcome in terms of the result of the technology is not effective. Still boils down on the training, and thirdly, sometimes some of the technology is a bit it could be a bit complicated. So the simpler to me, the simpler the better, because sometimes not me, I've heard where other staff members, they complain that it's a bit too, the process, what you have to fill in is a bit too long, and a lot of them want to like have a shortcut because maybe at the finishing of their shift and somebody had a fall, things that you have to input is a law. So if that could be to make it a bit simpler, so yeah, that's what I believe on. It's not really across the board based on where I work. It's not very effective. So sometimes we'll still go back to the old system. Yeah.
Just unmute myself. I think I saw a hand raised, but if I can just remind you just to use the Q&A function to answer your questions, that'd be great. Amanda, yeah, did you have your hand raised?
yeah, I just wanted to add that where that I find a lot of people do have problems is they feel as if it's an English test and they've got to write a perfect story. And it's like, so some people, they say, oh, I don't know how you spell such and such, and how do you spell such and such. It's nice to have the voice technology on it so that you can speak to it and it will translate. Again, sometimes it's a bit jibbity jobbity, a bit like talking to Alexa, but sometimes some people do struggle with writing English down, and what we always say is if you can put down what you can put down, don't worry about your spellings and punctuation, and that's not a problem. I don't know whether it would be nice if we could have some different languages on. So if you've got somebody in a second language who speaks their first language, who's not English, if they could turn it to their language, obviously then we'd have better scripts written if it could then translate it to the chosen language for that service. That's just a thought maybe for future or for development programs.
Yeah, I think that's something with the different language that's come across in the past. So yeah, I think that's definitely something that tech providers need to be a bit more aware of. There's a few comments coming up in the chat, that's fine. But yeah, just a reminder about the Q&A with regards to if you have any queries and questions, that'd be great. Thank you. Okay, so I guess we've kind of touched upon this a bit, but Destiny, did you feel that you were brought along the journey with regards to when the tech's been introduced? Like you and your colleagues, have you been?
I think the network's a bit it's a bit shaky. So can you repeat that, please?
Yeah, sorry. Yeah. So do you feel like you've been brought along on the journey when tech has been introduced in your care home?
I would say yes and no. The reason why I said yes and no is that yes, because they were informed that it's a particular date that they will come and introduce a particular tech, and they were going to have a training at a certain date, which we made ourselves available. Like I said, the training is not all inclusive, and I would say no because the practical application of it is not it's not very effective. That's what I would say. And like what Amanda just said, I think that will benefit a lot to us, the carers, in terms of the recording, if they could have like a voice recording, because some people might struggle to type everything correctly in English language. So if they have like a voice recording that will recognize different accents, that I think that might lead to more accuracy in the information recording. If you're recording your data and they could recognize different accents and interpret it to an English language, I think that would do help, because sometimes people write differently and sometimes you struggle to make sense of what people are writing. And the tech that will be introduced to, sometimes in terms of like, for instance, ANI, like the incident and accident recording, sometimes it's very long and it takes a lot of time. If you short staff, to fill out everything. So that's why sometimes it feels like copy and paste, because you still got priority is the care of the resident, their own safety. But when you haven't got that time to write it, you could write it a lot better, but because you're trying to cut corners, you got a lot of workload to do, you got medication that is running low, you got things to chase down. So if it's a bit to make it a little bit less complicated and more simple, I think that will lead to better results. Yeah.
And so it kind of goes back into maybe they consulted you a bit more on what would work and what doesn't work. Amanda, do you feel like you've been brought along on the journey? I think you probably
Yes.
have a bit with the Nourish, but yeah, if there's any more you can add to that.
I have, but I think what people have to remember is being open to change, and whether it's right or wrong after it, and then be able to review it and then get your feedback from your staff, because I think that's where it's important that there's a lot of people who even now who look at a mobile phone and think, oh, I can't do that. Can you send a text? You're quicker than I am. I'm like Destiny says, it is quite time consuming, and the young ones are so like on the phones, but like us older ones are a bit like, I'd prefer a keyboard myself. Elf, but yeah, but I do think it's been open to change, because we did have a lot of people who, oh, I'm not doing that system, I'll just write notes up and then somebody else can do mine onto it at the end of the day. But eventually everybody has changed over now, so things are just changing now with the AI coming in.
Yeah. And we've actually got a question about Nourish again in the chat. How did you overcome an issue of not having specific risk assessment interaction on Nourish system, or did you just incorporate it to the care plan?
So we do have the risk assessments on Nourish. I'm not sure what they're actually referring to, but there is the risk assessments on there, and then you score them and you add them up. But yeah, we do also have risk assessments, which we still do like on paper, and then we upload them as supporting documents. So if you're going on holiday with somebody and you've got to do your bid, your notice of interest and everything, then we'll still do some risk assessments. And then obviously, as in everything is an ongoing risk. Even walking through a door is a risk, because you don't know what's going to be behind it. So so again, you've got your own risk assessments acting constantly out throughout the day, but then you've got your written ones, which are there. They're either uploaded as supporting documents or they are on there. Maybe that was when they first started, maybe they might be referring to.
Yeah, if you wanted to expand in the Q&A, do let us know a bit more on that. We've also got
Right.
some questions flooding in on the Q&A, which is great. Just while we've still got you, Amanda Jane, and then there's a couple for both of you and Destiny. Does the Nourish Care Plan system have icons?
Yes.
That's it. Good answer. Perfect. Okay. And for Destiny, given your issues with your current DSCR and digital care planning system, it might be an idea to look at changing and using a system that is on the DSCR assured solution list. Unless, do you know if they're currently on the assured solution list, your current system? This is for Destiny. Are you still there? Was he frozen? Or he looks like he might have frozen.
I would say as well, just to interrupt, I'm sorry.
No,
And
no,
I
go
know
for
that
it.
I'm pushing Nourish, but I don't actually, I just said that I give everybody a option. I don't know any other system. So I know that I'm in praise of Nourish, but I've got nothing to refer to it. And also they have a little man at the bottom of the screen all the time. So you can ask him questions. How do you do this? Where do you do that? And there's always somebody at the end of the line, or an IT question to them. They're there for you.
Yeah,
But
absolutely.
again,
No,
I've got
that's-
nothing to refer it to, so I can't compare. I'm sorry, I seem biased.
No, that's fair enough. And I think a lot of the other systems will have a similar setup, I'm sure. But it's good to hear from one that you're using and you're using successfully. Okay, hopefully we'll Destiny will be able to come back to us in a minute. But I'll just kind of carry on with the questions we've got. What resistance did you face when rolling out the new tech in care?
I think what the new, it was everybody had got to remember their new passwords for it.
That's where you need a
Again,
password manager.
and
We've been doing a lot on this at Digital Care Hub.
Yeah.
I think it needs to be 15 characters
Yeah.
long. So yeah.
It was a long one, and the way that it just throws you a random one, which was, it's normally 2 words and then a number. So it might, I don't know, it could be car lollipop or something like that. And people seem to have kept them because they're so randomly chosen, and that they've kept them. But then people go, I don't know my password. And it's like, right.
Yeah.
But I think that was one of the biggest challenges. And again, and even when you're asking about it, it records everything, and then when you get back to servicing, you log back onto your internet, it uploads everything.
So even if it's you don't have the internet. Yeah.
I can't think of any other downsides.
That's brilliant. Thank you. Destiny, I think we lost you for a minute. Are you back with us? Hopefully, yeah, you're moving now. You were frozen before. So we just had a question which was around your current digital social care record and whether you need to potentially think about moving to a different record that's on the Sure Supply list. I don't know if your current one is on the Sure Supply list, but yeah, I don't know if you're having a lot of problems. You mentioned a few sticking points with your DSCRs. Hello?
I think we might have lost him again.
He was like moving slowly.
I think it's breaking. I can't hear the question properly. Could you repeat that? Sorry.
I was just saying about one attendee has said about maybe changing your your digital social care records to a different provider that's on the Sure Supply.
Hello.
That's what I think. We're struggling a little bit with signal, so don't worry too much. Maybe we'll just see if it stabilizes and we'll come back. So we've got a bit of kind of information coming through on the Q&A. I'm just going to read it over. I'm not 100% sure of the question, but solving training issues when work nights, weekends, bank holidays, home visits, out in community, off sick, in meetings, before medical emergency, after incidents, etc., bereavements, high workload. So tech could help if typing information, speech to type. Yeah, I know that there's some systems that you can speak in and it types out. It's very difficult if work part-time and you don't see your manager. Online, offline meetings, e-learning is not sufficient. Need to check practical skills. So yeah, I get that's a lot around the training as well, isn't it? Which seems to be coming up quite a lot at the moment around this. Every business has their system, so profit before people. advanced care planning flowchart, lack of staff funding, rapid staff turnover, increased needs. Daily assessments are very time consuming, lack of breaks and human error. So what happens if phone or internet fail? Yeah, on the phone and internet fail, that's an interesting one. We're doing some stuff around digital to analog to digital as well. And the government is releasing a lot because that's about to, all analog will be removed. So you need to make sure you have a backup, and that applies a similar situation to that as well. Olivia, did you want to come in?
Yeah, sorry, just because I found that part very interesting about, what happens if the phone, fails or the internet fails. And I think it also goes back to a previous question that was asked in the chat about whether it's better to outsource mobile phones to give care workers or whether to expect them to use their own personal phones. And this is something that we have spoken about with care workers before. And one of the things that they've said that I hadn't considered before either is some care workers can exist in data poverty. And say, for example, if they are going to a place where perhaps internet connection isn't very strong, they're going to have to then use their own personal data on their phone to be able to record and cite that visit, which then means that there isn't any data left over for them for personal use in the month. We've also had care workers talk quite a lot about signal issues and the issues that then brings up with recording. So, for example, sometimes they've been to an individual's home, they've recorded everything correctly and as they should, the signal's gone, they've gone back to their personal home and all of the information is gone, and it says that they haven't recorded that visit and therefore they don't actually get paid. I also think personally, one thing that we've talked about a lot is that kind of separation between work and life and having that balance. Having that app continually on their phone means that there isn't really that separation. They don't get the ability to take that mental break from work, because even on their days off, if they're worried about somebody that they're delivering care or support to, they might feel inclined to click on that app and go, oh, I'm just going to check that somebody's done that for them today. So that's something that I think is really interesting and needs to be covered a lot more.
We are actually doing a project at Digital Care Hub on bring your own devices. So we were looking at releasing more kind of support and guidance around BYOD, because I don't think there's a huge amount out there. Katie?
Hi, everybody. Sorry I couldn't be here from the beginning. Katie from the Digital Care Hub. I just wanted to come into this point, Olivia, because it's something that I really feel quite passionately is something we need to be thinking about as a sector, about how we're making sure that people have access to the data that they need to do their job, but that isn't impacting their personal life in any way, and also not impacting their own financial ability to do their job if you're expected to pay for your own data packages. And there's a lot of great work on this, which has also been done by a charity called the Good Things Foundation. We're not affiliated with them in any way. I just am a huge fan, and they have a part of their work. So they're looking at sort of equity around data access and data poverty in the UK. And they have a data poverty lab where they can work with community organisations to provide data packages to people who are in most need. So if anybody who is on the call or anybody here is sort of really interested in this in their local community, it can't be done on a national level, but it might be worth getting in touch with a data poverty lab and seeing if there is sort of a community way that you can support care workers with access to data to do their jobs.
Brilliant. Thank you, Katie. We've just got a question, Amanda, for you. Are you using any other of Nourish's extras, such as GP Connect? And is it linked to any other tech, such as Roseanne, a remote monitoring kit?
No, I'm not using any of those.
Okay, that's a quick answer. Is it something that's on your radar, do you think, for you and your care home, or not really?
I don't have privileged knowledge to that. I'm just a support worker.
Well, now you know about it. Maybe you need to go back and go, I was on this
Yeah.
webinar. Is this something we can do?
I know that we are using AI, but I don't know which program it is that's using, because it's changing things, and I'm like, we've been and done this. But why have we got this? And it's like I'm having to override it to get things back.
Okay.
But
so a bit round
I do
to
know
maybe
that,
you have.
yeah, I do know that obviously technology has got to be the better thing in the long run, and everything's got its disadvantages and its advantages. Even if you was unfortunate not to be in a house fire, you're going to lose everything, and but then you might be able to save the technology. But so,
Yeah.
and then like you say, you might have, but also, what was I going to? There was one thing I was going to say about, if the technology is down, so if the internet's down, and ours will automatically save to the phone only until you get an internet access. And then also with Nourish, with my company, they're not on your personal phones. It's another phone that you take around with you. So
Right.
again, if you're not at work, you shouldn't be logging on to those systems anyway.
Yeah.
And I presume that our managers would be reprimanding you if you were logging on because of your GDPR. If you've got your work hat on, then you're at work. If you're at home, switch off.
Yeah, you shouldn't be looking at it. Okay,
No, you
brilliant.
shouldn't. No, I can understand people's concerns, but that shouldn't be a concern of yours. If you are concerned at home about somebody, then what you should be doing is contacting your manager and saying, excuse me, I'm really worried in case this person hasn't had their medication.
Yeah.
Could you check on it?
Yeah,
And then
definitely.
it's in their hands. You've passed your concern over, your duty of care.
Yeah.
I know that we're paid in smiles, and we do this job because we're caring and compassionate, but we do have to hand it over.
Yeah, you still need to have your due diligence around you. Yes,
We do,
absolutely.
yes.
Olivia and then Destiny. Olivia?
Sorry, I don't want to butt in because, like Carolina was saying, I think it's incredibly important to hear from Destiny and Amanda
That's okay.
Jane.
Yeah, it's all good.
But there were two things that Amanda Jane just said that I wanted to touch on. Number one, just a support worker. You are a support worker, and that's an incredibly important role. And I found it really interesting when it was said that Amanda Jane isn't privileged to know that information. And I find that really interesting, that there is this major gap in kind of what information is allowed or not allowed or seen as right to be able to pass down onto care workers. And I think that's also where a lot of the resistance comes from, is that they aren't actually being consulted about the technology. More often than not, it's handed down to them. They are told to use it, like Destiny highlighted, learning from others, other care workers. And that's where a lot of the resistance can come from, is that they're expected to follow what's being handed down to them. And then with that comes a sense of, well, where does accountability lie when things go wrong? And I know that's also been a big discussion. So I just wanted to put my 2 pence in there.
No, that's all right. Brilliant. Thank you, Olivia. Destiny?
Hello, can you hear me?
Yeah, if you keep your camera off, that might help our tech a bit.
Yeah, okay. And where I want to comment in here, like the EMAS system that we use for the medication ordering and medication administration, because sometimes that's why I think that we can't really rely solely on technology, because there are some occasions where the internet was down and the scheduled medication, we couldn't administer that to the patients. So we have to still go back to the paper map to administer medications. And we had an issue, problems where the paper map wasn't up to date because of the change of the medications and the change of a new medication like antibiotics and all that. So because of that change of medication, usually what we do, like monthly, we tend to print out the paper map and leave it in the treatment room. But sometimes when there is change of prescription within the interim cycle, and the internet happens to be down from the EMAS system, so we might struggle to give the right medication to a patient. So that's the problem that we've encountered in the past, just to point that
Yeah.
out.
No, that's a really valuable point about the internet strength. And I think the more tech that's added on as well, it's like, can the internet handle it? So it's infrastructure. But thank you very much, Destiny. We have got a few more questions, but I'm just conscious of time. We've got Dan to present. So if Destiny and Amanda Jane are okay to stay on, we'll hear from Dan, and then hopefully at the end we can pick up the rest of the questions and any other questions that come through. Right, Dan, I'm just going to share your slides. Here we go.
Hello, yes, brilliant questions, by the way, guys. I think it's a really, really valuable discussion to be having. Yeah, so I guess to give my perspective, and if we go on to the next slide, please, Eleanor. I'll probably be saying that a lot. So just a little bit about me quickly. So I used to work in a care association supporting people to go into frontline care, so care certificate support, that sort of thing. I'm head of program delivery for Digital Care Hub at the moment, and I'm also a trustee of a supported living charity, which is very much on that digital journey. And it's probably fair to say, Eleanor, Katie, even in Digital Care Hub, we're still on that digital journey. It is a bit of a treadmill that never stops, but as we'll discover with some of this, I guess there's a bit about how you pick and choose, how you go on that journey. So I think we've covered some of this already in some really valuable discussions. Social care, we're obviously under a lot of pressure. As a sector, we'll see it in the news all the time, which sort of leads people to the point, and I think it's been made a couple of times, that technology often feels like people will use it as a silver bullet and say, oh, well, this is going to solve all of our problems. Just implement these 5 bits of tech and everything's going to be fine. And actually, that's not true. It needs time, it needs support. I think, as Destiny really said before, it needs a lot of the training that's involved. We need to be able to actually properly implement it, rather than just kind of purchasing a system in and saying, well, this now solves the problem. It doesn't. It needs to be done properly, like any kind of change that we have in our lives. And the other thing I think is probably, it shouldn't be something that we find intimidating. It shouldn't be something where we think, oh God, this is another piece of technology that's now being forced upon me as a frontline care worker. It should be something that's empowering. It should be, here's the benefit to you in your day-to-day. As Amanda Jane was saying before, how useful is it to be able to use your voice to record your notes instead of actually typing things in on a phone? Even better, I agree with you, Amanda Jane, I prefer a keyboard over a mobile phone. So even just making those sorts of changes is, I think, really helpful to people and helps empower people to use technology in our jobs, rather than kind of just expecting us to use things because that's what the technology we've bought is. And next slide, please, Eleanor. I always like to start with tech in our personal lives. I think, we've talked a lot about like how you get the training, the competence, how you get the confidence to be able to use the tech properly. And sometimes it's just about bringing it right down to our kind of normal lives and saying, well, actually, we are good at technology. Pretty much everyone in this call will be good at some form of technology that we use, whether it's just your mobile phone, whether it's using online banking, smart speakers, Alexa, smartwatches. We will use technology in our personal lives, and it's about reminding ourselves of that and actually trying to find some of the similarities. And in particular, I've put Marks and Spencer and Co-op there, and I was really glad, Amanda Jane, that you mentioned some of the potential downsides of actually going fully digital. Means, yes, it does open up a very different vulnerability, I guess is the best way of putting it, where we feel, well, actually, if we put everything on digital, what happens if someone hacks that system? And what then do we need to have in place to make sure that we're minimizing all of that risk? But it's just nice, I think, to bring it back to our personal lives when we look at tech and not always think about, what am I doing at work? How do I use technology personally? Next slide, please, Eleanor. And then obviously, what do we use in our jobs? What do we use tech in care? Just really glad, again, we've obviously all on the same page with Carolina around care work is inherently human. Tech can't replace good quality person-centered care. It can support it, it can make it better, it can free up time on the paperwork to be able to actually do more care. It will never replace good quality person-centered care. It's impossible. And even if it were somehow possible with some sort of advanced robot, I don't know about you, when I draw on social care, I don't want to be cared for by a robot. I want a human being who will give me the dignity and the support. So I don't think we ever get there, despite a few of the suppliers that will say that sort of thing. The other point on that is around actually how much technology, and this is particularly for some of the owners and supervisors and managers in the call. There is a lot of technology out there. really we should be looking at what are our pain points. So what are the things we struggle with? What are the things we'd like to get rid of on our day-to-day lives? What are the things we'd like to automate away? And what are the things we'd like to keep? And make sure we have that balance in our work life as we would in our personal life. I wouldn't automate things away in my personal life that I quite like doing. You know, I think one of the most interesting things about stuff like AI coming around, Carolina mentioned earlier, there's really good applications for like generative AI that makes pictures. I still like creating art as well, so I wouldn't completely automate that out of my life. So why would we do that in the workplace? If there's things we enjoy, let's not get rid of them. Let's get rid of the things we don't enjoy. Surely that makes the most sense, from even from a kind of frontline care, but also from an organizational point of view. What's better for recruitment and retention than having happy staff that actually get to do more of the job they enjoy and less of the things they don't? So let's think about that when we're looking at tech. And again, at the bottom there, the ultimate goal, it really is about freeing up more time, usually to say, what can we implement so that we can care more for other people? That's should be our ultimate goal, not about cost savings all the time, not about kind of, particularly if there's any local authority commissioners on the call, not thinking about kind of the bottom line all the time. Ultimately, we're here to care for people. So let's make sure we're doing that. Next slide, thank you. And I wanted to pull out some interesting quickfire examples. So I know I've just said don't go looking for solutions, find what your problems are, and then find the thing that solves your problem. But actually, sometimes it is really nice to pick out some examples just to expand your mind and say, what is actually out there? We're not affiliated with any of the things that we'll see. They're just some cool things that I've encountered both through my work in Digital Care Hub, Natural Breaks, Care Association. The first one is one that's, you know, about 80% now of registered providers have some sort of digital social care record. So Amanda Jane was talking before about Nourish is one of those. And really that is a journey in itself, implementing it. As we've seen, you need the right training, you need the right ability to implement it. But also about if you've bought something in, and particularly it's really important, and to echo some of Destiny's points around, yes, if an organization's brought it in, that's great. Make sure you train us on it as frontline carers. Make sure that actually we've been given the right tools to succeed, because from the organization's point of view, you might spend a load of money buying this thing. It's useless if it's not being put into practice properly. Or in some ways might actually be far worse than the system we had previously, which worked and was functional. So making sure we get the implementation right is super important. And then once you've implemented it, and I know there will be a proportion of people who will be at that stage, get the most out of it. So I was really glad that Carolina mentioned before around we have such wealths of data about people's lives, you know, whether it's not even some of the obvious stuff, like a lot of the time we pull up things like falls, but it can even be things around like dehydration. It can be things around just the person's normal routines. So if we can find something, and we'll see in a little bit, there are some monitoring devices that look at, for example, when people are getting up and around at night. If there's a particular day that we can look at in the data and say, well, why is Jonathan always up on Friday evenings, therefore increasing the chance of falls? Can we have a conversation about that and work out what it is? Using that data is so valuable. It can really improve both the lives of the people we support, but also actually frontline staff. If we're more equipped with data, we can actually do our jobs a lot better. And the final thing is really to make sure that, particularly around the digital social care record push, there's loads of support out there. And particularly if you're someone who's an owner or someone who's a manager, definitely lots of support. And we do have a special interest group within Digital Care Hub to look at digital. So if you're someone that's digitally enabled, please do get in touch with us at hello@digitalcarehub.co.uk. We'll be happy to have you part of the special interest group. It's free. We meet, I think, once every couple of months. It's not a particularly onerous thing to be part of, but it's really valuable to be part of a community of people who have got that sort of special interest in digital. Next slide, please. So this was one of the other examples, was one that I'd spotted. It won the Care Innovation Challenge last year at the Care Show, one of the sort of national shows, trade shows, I guess you could probably call them. And it's just they called it hydration band. And it sort of looked like a Fitbit. So you probably have seen in the past, if you've done hydration monitoring, there's like these sort of, they're almost like blood pressure bands that you can use that help monitor hydration. But this one was a lot more sleek, discreet, And it just literally is a Fitbit type device. So it just sits on your wrist like a watch. And it automatically reads people's hydration levels throughout the day. It can alert you if someone's getting dehydrated. It stores the data over time, so you can see, okay, why is Jonathan constantly dehydrated on a Friday afternoon? Well, that also seems to coincide with his family visit, and he's a bit too busy chatting. Maybe we should prompt him to drink a bit more. There's little things that can be pulled out. So I thought that was a really interesting one to do a bit of a quick fire on. And next one, please. This other one is one again. So you may or may not be aware of this one, but it's called Nobi Lights, NOBI. It's been rolled out, across a few different regions at the moment with some NHS funding over the past couple of years. It's basically like an AI light. So it sits mostly in residential settings, so nursing homes, care homes, and some supported living. It does a lot of different things, but the really interesting part I thought about it was obviously it's constantly kind of watching, but it anonymizes the person involved, and it gives the user that option to be able to say, well, actually, rather than having a camera constantly on me, which I think is really uncomfortable, the AI turns that person into a stick figure, so that actually you're not looking at that person. The AI is just monitoring the stick figure. So if they fall over, the AI will then kind of alert and be able to say, oh, that person got up these times in the night. They were in these positions in the room. If they had a fall, it starts to gather that data around what were they doing in the past 10 minutes before the fall, what might have caused it. Really, really interesting piece of technology. So when we've done a couple of case studies from a digital care hub point of view on it, the amount of falls, if both detected that people just didn't know existed, as well as actually were able to then monitor and help reduce. I think there was a case study we did where it was pretty much 100% of the potential falls were then being completely negated. A fascinating piece of technology. And next slide, please. This one's probably really interesting, a bit more niche, but we were thinking about this from a natural breaks point of view, and there's a couple of the digital social care records that integrate similar sorts of technologies to this. It's called Pain Check. It's been around for a while now, but basically it's been trained on like a wide array of people's faces to be able to kind of double check whether people are in pain or not, and it's really, really useful for people who are kind of unable or unwilling to communicate that they're in pain at a time. And it just uses the phone. It's just a phone app. You take a picture or a video of their face, and then it helps to try and understand, okay, are there any indicators there that this person might be in pain? What's super interesting about it from an organizational point of view as well is that it's integrated into a lot of the different kind of care record systems and some of the clinical stuff that the NHS uses. So as we begin to see people move between settings, actually some NHS settings will become more and more familiar with this way of looking at things. It's also quite useful at looking at kind of data over time to be able to see, oh, right, this person we can visibly see and we can demonstrate, kind of as Amanda Jane was saying before, it's not written down. If it's not recorded somewhere, it doesn't exist, but actually you can then demonstrate and say, well, actually we can show if this person's become more comfortable over time or is in less pain or more pain over time. Really interesting piece of technology, I thought. And the final one, this is one that we were looking at as part of, and one of the ones I demonstrated as to our supported living charity Natural Breaks was a piece of research that was done around virtual reality. So you'll see the guy on there who's got a pair of virtual reality goggles, which, as I've discovered, are actually more affordable than I realised. But the paper itself looked at people with learning disabilities and autism who were essentially uncomfortable using public transport by themselves, didn't feel confident using public transport. And anyone who's ever took or supported someone to be in London on the tube will understand the real nightmare of that one. And if we drop onto the next page, sorry, onto the next slide, you'll see there's a sort of image on the right-hand side there of this is basically what it looks like within that virtual reality. You can see the bus routes, you can see where people are going. You can kind of then start to have that conversation with someone you need to support to be able to say, well, here's how we would do this. Run them through the scenario again and again and again so that they feel most comfortable with the situation. I thought it was a really interesting piece of research. And I wouldn't be surprised if we don't see more of this actually in the future. yeah, say especially for things like London, I would quite like one of these to navigate London. Never mind, supporting someone with LTE. Go on, next slide, please, Eleanor. And we've touched on some of this actually already, but I guess it's always really important to people to say, yes, with Digital Care Hub, we advocate for technological use in frontline care, in any care organization. That doesn't mean tech solves every problem. It doesn't mean you should use tech for every problem. And really trying to decide when you should and shouldn't use tech can be like an entire process in itself. And I've listed out some of the questions I've used and we use in our service as well around like, does this solve a problem? Or is it something that's a problem that is just looking for a solution? So what are our problems? Does this actually solve any of our problems or not? It sounds obvious to say, but actually when you're out there looking at the 500 different pieces of technology, it can be quite difficult to figure out, well, what's actually going to solve our problem. And if you keep a sort of, we do, or I do at least, keep a bit of a list of, here are the main problems I have that I'd like to go away if I could use a technology piece. It feels really good when you see a piece and you go, oh, that solves my problem actually. How much would that be? You know, what are we talking? Have a conversation with managers, etc. As well as, and I think again it touches on some of the stuff Destiny said, is trying to figure out what the actual problem is in the first place can be a really tough one. So, Destiny's really articulated really well there that actually in his case, a lot of it has been a skills problem of we need the training and the training isn't at the right time. And we would quite like it actually if we could be trained on the systems we're using, which again sounds obvious, but it's not always the easiest thing to implement from an organization's point of view. And for anyone that is obviously working in frontline care, make sure you articulate that to people, your managers, supervisors, in any kind of one-to-ones and supervisions. The problem is I haven't had the training, I haven't had the skills, this is what I need. That often cuts through a lot of the nonsense and helps people kind of decide, oh, right, the problem isn't that we need more tech, we just need to train you on the tech we've got in the first place. Fantastic, okay. And then focus on the thing that obviously matters most. What do the people you support need? What do you need as someone who's in frontline care? And from your organization's point of view, if you can link those together and say, actually, if we did this thing, if you trained me on this system, here's the benefit to the people we support, here's the benefit to me, and here's the benefit to the organization. Perfect. Nobody's got any excuse to say no. You've given them every excuse to say yes. And next slide, please. I'm staying safe using tech again. Really glad a couple of these points have come up. So at Digital Care Hub, we have an annual sort of we have a piece of e-learning that we've developed specifically around data protection and cybersecurity. It's completely tailored to our sector, to frontline care. So please do use that. It's completely free. You get a little certificate afterwards. On password policy, it's one that's come up a couple of times, but the sort of recommended guidance says you should use 3 random words. So just pick 3 random words and go with those for a particular policy. Even better, I would say, use a password manager. That can be one that's based in your browser, so Chrome or Edge or whatever you use. But just use something, and again, this is applicable to personal life as much as it is our work life. Having our passwords easily guessable is never good for any of us. The other thing I would probably add to that is you're probably familiar with what we call multi-factor authentication. So the idea that you'll have it in your banking app. So you open up your banking app, try and do something that says, here's a code that we've just sent to your mobile number. Please put this code in. Perfect. That's the most secure thing we can do. So if you haven't got any of those things enabled or poor passwords, definitely sometimes have a chat to someone about, whether that's your supervisor or from an organizational point of view, but that's your staff. Well worth having a chat about to make sure that effectively we're keeping good passwords to keep us secure. And the final one is just making sure, and again, this was a sort of point that was touched on a little bit earlier, I think, is making sure that we keep some sort of regular backups. So your organization will have a business continuity plan if something happens, but even just from a personal point of view, like how do we back up the things that are on our phone? How do we make sure that we're not going to lose signal, as someone said earlier, and you essentially end up with a situation where all of the stuff you've written down just isn't, is gone. And how do you then flag that to someone to be able to say, well, here's what's happened. What are you guys going to do to fix it? Is it a supplier problem? Is it something you can do to provide better mobile phones or better signal? Is there a process we can implement to make things easier? Having a bit of think about those allows us to stay safer. And next slide, please. Final couple of ones are just around some of the support and resources. So obviously Digital Care Hub, we have lots of support and resources. Care Workers Charity, exactly the same. And Olivia's been putting some really good, useful links throughout the webinar. Local care associations, trade associations, membership organizations, being part of a community is one of the easiest ways to do that. So whether that's the Care Workers Charities interest group, whether that's from an organization's point of view, our special interest group at Digital Care Hub, just being able to share those experiences, I think, especially in our sector where it's very much person-to-person focused, so much better than kind of feeling like you have to go at it alone. The final thing really, is I think based on some of the conversations we've had, is definitely encourage people to speak to some of the suppliers as well. So if they're not providing the right training, or if the technology isn't doing what we want it to do, flag it to someone and make sure that they're aware. I think that's one of the most important things we can do. And next slide, please. I think I just have some final thoughts on. Yeah. So again, to reiterate, technology is just a tool. It's like anything else that we use. It's not there to replace people. It shouldn't be there to replace people. It definitely isn't a replacement for person-centered care. It can't ever do that and shouldn't be able to. When we are thinking about technology, both in our personal and work lives, start small. Don't be afraid to be curious. Yes, be cautious about what risks am I opening myself up to, but don't let that get in the way either. And most importantly, obviously, don't be afraid to ask for help. Whether that's in workplace or whether that's in your personal life, there will be somebody who is quite tech focused, either in work or at home, to be able to say, okay, well, what can you do to help me? This is what I don't understand. And often that can kind of be the best piece of support we have. I think Amanda Jane was saying before about like digital champions and that sort of thing. It's so useful to have. And the final one is the same sort of plea as Carolina earlier of let's make tech actually work for us in care and not make it so that we're somehow serving the needs of the technology we've brought in. Ultimately, we're carers, we're caring for other people. Let's make sure it serves us as carers, not as the kind of technology that we've got. And I think that's it from me. I think that was everything.
Brilliant. Thank you, Dan. I think that summarised everything quite nicely that we've heard from, which is brilliant. So thank you. I think there was a question that came up in the chat that Katie said you were going to pick up.
Oh, yeah, just the one from your guest about whether it's mandatory requirement for all patient care related data to be updated to the NHS database via an API. So most social care organisations, care homes, home care aren't part of the NHS formally. So they will be doing either cloud storage themselves or storing locally. Some information obviously does go into the NHS record, but we don't have direct access in social care to the NHS via APIs yet. That is definitely sort of coming and is on the roadmap, but we are several years away from that happening.
Brilliant, thank you. We've got a couple of other things that have come up in the chat from Lorraine, who uses person-centered systems and feel it sounds similar to Nourish. Her question is, if you needed a specific chart or found that one was needed, i.e. a PEG or a Tracy records, could you ask Nourish to generate one or request a specific chart to be added?
I believe they're already on there, the PEG feeds and everything. But again, you'd have to contact Nourish for their full details and see what is available for them. But I don't think that you have to pay for anything extra with them because it's all on there. Whether we've got a license for everything, I don't really know.
Yeah, whether there's different levels of license. Yeah, brilliant. Thank you, Amanda. Lisa's just picking back up a point. I don't know, Dan, if you want to pick this up because I think.
Yeah, shall I? Yeah, I originally went for this one, but yeah, Lisa's a bit more in depth, I think. Yeah, so it was around bringing your own device. Let me go back to Lisa's original question. Yeah, so it was around if you're using your own phone, how do you protect against GDPR breaches outside the building? So they were saying their system's got like a geo fence in it, so it stops kind of as you go outside the building, that sort of thing, it stops access. And we sort of originally said there are these pieces of software called mobile device management pieces of software. So it allows you to create like a pocket within a device. So there's things, the Microsoft one's called Intune. And it basically allows you, you create a little pocket within the mobile phone where you can then say, okay, well, if we don't want this person to be able to have access within these hours, or we don't want this person to be able to kind of access, or if the person leaves the organization, we can just completely wipe this pocket. So we're not touching the rest of their personal mobile phone, but just within that pocket of kind of your work apps, you can reset, you can do all sorts of things in there. But then Lisa had a really interesting follow-up question around if people are using their own phones, how do you effectively stop them looking at data outside of work? Whether they kind of lose their phone and can kind of discuss any of the personal details. And I think a lot of that ultimately is about the training that you provide people. There are technological solutions for it. So some of the more advanced mobile device management will do that. And obviously, if you're giving them staff phones, you can kind of get them to leave it in certain places. But a lot of it is just also about the professionality of being able to say, well, here's our training, here's what our policies and procedures say, here's what we do or don't discuss. Ultimately, the phone does enable that more, but they could also be kind of discussing that sort of information, even if you gave them their own phone that they leave at work. So a lot of it is just about making sure people are aware of the right policies and procedures, the right types of data protection they should be following. I don't know, Katie, if you wanted to add anything to that one, but that's my main thoughts on it.
Yeah, I think there's just lots of different approaches to sort of device security when we're asking people to use their own devices. I guess something I would also flag is that obviously there's always been a risk of data usage, particularly when talking about home care, even when you're on paper records. Some of the only finds we've seen from the Information Commissioner's Office, for example, around data breaches in social care has been where people have left care files and care records in paper formats in different places, not obviously on purpose. I don't think anyone's doing that, but the classic, you leave your coffee cup on the top of the car when you're in the car park and you're shooting off, but instead of that, it's sort of like a care record. So there's risks of any approach. We do need to make sure we're balancing sort of ways of mitigating risk with actually not making people's jobs too hard. You don't want to lock down somebody's personal device so much that they can't even use their own phone, but you also as an organization need to be thinking through what's going to keep people safe.
Thank you, Katie. And we've just got another question, or I don't know if it's a comment, but tech companies have a responsibility to co-produce their systems with care workers to ensure that they are fit for purpose. Care workers are the experts and should be recognised as a valued voice in R&D. And I think, yeah, that's what Amanda, Jane and Destiny have mentioned on as well, haven't they, about making sure they consult the care workers when they're producing tech. So that was brilliant. Thank you. Thank you for all your other comments as well. Really good to hear. And do pop anything else in the Q&A. But just to kind of finish up, it'd be great to ask Destiny and Amanda Jane. I guess we'll start with Destiny, if you can hear us, about what are your hopes for the future with regards to tech and in care?
I think I'm quite positive, despite the current challenges that we're facing now. Obviously, I'm not trying to be like resistant to tech or to change. I'm just being honest, giving my honest opinion based on what we're experiencing now. There's no point me painting it so glamorous and we struggling. So I believe that if we're included in a working collaboration with the care workers mainly, I think the practical implication of it will be very, very effective. But at the moment, it feels like they just throw it on us, and which is really bad. So I'm quite positive. I don't want to be all negative. I'm quite positive that hopefully, so hopefully in the future it's going to lead to like a better care experience for the residents, and also it's going to help the carers to make things a lot more easy and accuracy. So to improve the quality of care of the patient, that's what I believe in. So yeah, a big positive. Yeah.
Brilliant. Well, that's good. Yeah, I mean, it sounds like you've had a few wobbles along the way, but you've worked it out. So it's not necessarily the end result is the problem for you. I think it's been the kind of training and journey along the way, which has come up as an issue. Amanda Jane, what's your hopes for the future with regards to tech and care?
Well, I know that with our managers, they're just bringing in, we've just piloted a system called Radar. Now, this is more for their dashboards and what it's showing up. But for me, it's looking into the future. Hopes for technology and care is that it continues to simplify administration tasks and improve communication between the care staff, service users and the family. Also hope to see more technology that directly enhances the quality of care we provide, perhaps offering more real-time insights or more personally supported tools. Ultimately, I believe technology has the potential to free up more time, but like you keep saying, we need to make sure that it's direct care and building relationships, and that the training and the refresher courses are there, because some people they move on and it's like, right, we don't do that anymore. We've now got this bit, or we're adding this bit, or we're taking this bit away, or we can now do this bit, like you say, for those pain managements. I know Nourish has got that on there. And I think we've got they've changed it also, so that if you walked in a room and somebody had got some where they'd been scratching their arm, you'd have to do literally one thing for a finger with a mark on it, then you've got to do for the second finger. So now you can actually interact the whole issue. If somebody's scratched all up their arm, you haven't got to put like 6 individual things on, so it's producing saving your time and things. So again, it's having the updates from the systems. And I think, like you say, that if you find your team struggling, don't be afraid to say, oh, you're struggling in your team meetings, and say, would anybody like a refresher course? And then offer it out to Nourish or whichever system you're using, and say, hey, is this the correct, are we using it, the crane? They seem to have a problem with it. Speaking up, basically.
Yeah.
And like you say, getting your input from the support workers and the care frontline staff who are using the systems, and saying, what's not working? Is this time consuming? Is there a way to make it quicker? I mean, like you say, on some of ours, as I've just put some tick boxes in, so you can say bed made, things like this. It's rather than you having to type, I've made the bed, I've done this, I've folded the creases, the aircon's on. And if you've just got a few tick boxes to try and save some of those, but then that's all incorporated in your actual text that's printed out for that transaction.
Brilliant. Thank you, Amanda Jane. As I think Destiny said earlier, it's like learning from each other, like he learnt it through colleagues. So I think you are kind of, a powerhouse in yourselves amongst each other. So that's what you need to, if you're stronger as a group than individuals. So going to your management, if you all had the same worries and concerns. I think there was a question about what does Radar do that Nourish doesn't. I don't know if anyone's able to quickly offer any insight on that.
So your Radar, it's like a dashboard. Again, somebody else stop me if they know more. I don't really know the system yet. It's just being piloted. So it'll give you a dashboard to say whether like everybody's up on the training or your audits are done. So your house manager will go in and then they'll put their, is it KIPs on, and then they'll put everything into that, and then it'll read out. But hopefully it's a simpler system to save the managers time, because they're obviously getting more and more paperwork and things to do, and they're forever doing MASH reports and things. So
brilliant. Thank you, Amanda Jane.
But yeah, Radar's not for the front line. Radar's for recording of everything.
Yeah, brilliant. Thank you. So I've just conscious of time. We've done pretty well. Like, thank you so much for all your questions. Like, you've really made the webinar. I feel like there's more to come with all these questions, which is amazing. A massive thank you to Amanda Jane and Destiny. Like, we really appreciate you coming And I think that's been a massive pull for this webinar, to hear from you as frontline key workers. So thank you for you both to coming and giving up your time, and Olivia and Ikram for supporting and coordinating from that side. So thank you. But yeah, thank you for joining us, everyone. As I said, it will be recorded and it's on YouTube, and the transcript as well will be sent out for those that are registered on Eventbrite. So you'll have access to all of that. But yes, thank you very much, everyone, for giving up your time. Really appreciate it, and have a good rest of your day.
You're
Thank
welcome.
you.
Bye.
Bye.